Hello, everyone. Today we are going to discuss a very important topic, a major health challenge, in fact, high cholesterol. It's often called a silent villain, and for a very good reason. So in this session, we are going to understand the powerful medications that are designed to fight it. Jello, let's begin.
First things first, we have to understand the scale of this problem. You see, high cholesterol is not some minor issue. No, it is a huge risk factor for very serious conditions like heart attacks and strokes. The data is absolutely clear on this. The higher your cholesterol climbs, the greater the danger. This is the main villain in our story today. Now, this is where the story gets really interesting. Of course, lifestyle changes are absolutely critical. We'll talk about that. But we also have some very powerful pharmacological tools at our disposal. So the question is, what if a key to managing this risk and preventing these terrible outcomes is already available to us? Let's explore the heroes of our story, the medications. Okay, first up, Section 1, the silent villain. Before we can get to the solutions, we need to properly understand the problem itself. What is this cholesterol, and what are the numbers we should really be watching? Let's see. Now, have a look at this table. It shows the numbers that really matter to us doctors. Your total cholesterol, you see, should ideally be below 200 mg per deciliter. But the one we are most concerned about is the LDL cholesterol. We call it bad cholesterol for a reason because it's the type that deposits cholesterol into your artery walls, building up plaque, almost like rust inside a pipe. Ideally, this number should be under 100. Once you get into the 160 range or higher, well, you are in the high-risk zone. So, why do these numbers matter so much? What is the big danger? It is this: atherosclerotic cardiovascular disease, or what we call ASCVD. This is the hardening and narrowing of your arteries because of that plaque buildup we just talked about. And that can then lead to heart attacks and strokes. The link is direct, and it's very dangerous. All right, so now that we understand the villain, let's meet our champion. Section 2 is all about the most important class of drugs for lowering cholesterol, statins. They are truly the first line of defense in this battle. And why are they the first choice? Simple, because the evidence for their effectiveness is just overwhelming. For any condition that involves high LDL and total cholesterol, doctors almost always turn to statins first. They are the proven standard treatment, the gold standard. But here's a very critical detail you must understand. It's not just about being on a statin. No. The effectiveness really depends on the dose. A doctor won't just prescribe a statin, they will prescribe a certain intensity of therapy. As you can see here, the real power is in the dose. Now, what's so interesting here is how clearly you can see the difference. A moderate intensity statin therapy, it can lower your bad LDL cholesterol by about 30 to 50%. That's good, but look at the high intensity therapy. It can achieve a reduction of more than 50%. This is a very significant difference in protective power, you see. And you know, the beauty of statins is that they aren't just number crunchers. Their benefits go far beyond simply lowering the LDL levels. They also stabilize those dangerous plaques in the arteries, making them less likely to rupture. They suppress inflammation. They even reduce the risk of certain blood clots. They are truly multi-talented heroes in this fight. Now, sometimes our main hero, the statin, needs a bit of help. The battle against high cholesterol can be complex, so for specific problems, we need to call in the specialists. So this section covers the other classes of drugs that can join the fight. First up, we have the fibrates. Now you should think of them as specialists for a different lipid problem, high triglycerides. By activating a key enzyme in the body, they can lower triglyceride levels very, very effectively, by as much as 20 to 50%. Next, we have nicotinic acid, which you might know as niacin. What is its special skill? Well, it's the most effective drug we have for raising HDL cholesterol, the good cholesterol. We call it good because it acts like a garbage truck, you could say. It picks up excess cholesterol from the arteries and takes it back to the liver for removal. So, nicotinic acid is our dedicated HDL booster. And finally, meet ezetimibe. This one has a very clever mechanism of action. It works right in your intestine to block the absorption of cholesterol from the food you eat. So it acts as a perfect sidekick for statins because when you combine them, their LDL lowering power becomes much, much greater than either one could achieve alone. Teamwork, you see? So with all these different weapons available in our arsenal, how does a doctor actually form a battle plan? This section is all about the clinical guidelines for treatment, how we decide what's right for each individual patient. The decision-making process is very logical, very systematic. First, the doctor identifies which group the patient belongs to. Do they already have ASCVD? Are they diabetic? Second, we calculate their 10-year risk of a cardiovascular event. Based on these two factors, third, we choose the correct statin intensity, high or moderate. And finally, if needed, only if needed, we consider adding one of those specialist drugs we just discussed.
We've talked a lot about medications, about these powerful pills, but it is so crucial to remember that the story doesn't begin or end with a prescription. We must always look beyond the pill.
This slide here shows the absolute foundation of any treatment plan, lifestyle modification. This is where everything starts. Things like a healthy diet and regular exercise, they directly impact your cholesterol levels and your heart health. Managing weight reduces the overall strain on your cardiovascular system, while stopping smoking, well, that prevents direct damage to your arteries. These things are non-negotiable because they address the root causes of the problem.
So, we've seen that the drugs we have are truly remarkable. They're powerful tools in our fight against cardiovascular disease. But this brings us to a final and very important thought. Knowing that lifestyle is the foundation of all prevention and treatment, is the ultimate victory over this disease something that lies not just in a pill, but truly in our own hands? Something to think about. Thank you.